In this video, a patient with end-stage kidney disease, we'll call him SR, is brought in for his first dialysis session. Like many others, he was told there was no turning back, that his kidneys had failed, and that he would need dialysis for the rest of his life. But SR wasn't convinced. Something didn't feel right. He was still urinating, not much, but enough to make him question the severity of the diagnosis. His instincts told him his kidneys hadn't completely given up. As if by fate, SR heard about a clinical trial led by Dr. Singh, focused on an antioxidant with the potential to restore kidney function. It was a last-ditch effort, a long shot, but a real chance. So SR signed up. He was told that if his urine output increased to over 1,000 milliliters per day, there was a real possibility that his kidneys could recover and he could stop dialysis entirely. What happened next was that SR began tracking his urine output like it was cryptocurrency, checking every 5 minutes, thrilled by every tiny increase. Then, the unthinkable happened. After just 4 weeks, his kidney function began to improve. By the 8th week, his nephrologist said the words no dialysis patient expects to hear: "You can stop dialysis." Just like that, SR became one of 9 patients in this groundbreaking trial who escaped the grip of dialysis, thanks to a single powerful antioxidant. Let's talk about the clinical trial SR joined, in which 9 people were able to stop dialysis. The first thing you need to know is that it happened in 2003, yes, over 2 decades ago, when cell phones were still new, Britney Spears was still innocent, and apparently, kidneys still had a fighting chance. A group of end-stage kidney disease patients were able to lower their creatinine levels, increase urine output, and in some cases, leave dialysis behind. What's even more astonishing is that they used only one antioxidant, just one. That's right, a single molecule did more for these kidneys than the entire US healthcare system combined. Not exactly a high bar, but still impressive. Now, imagine what we could do today with everything we've learned since then. Back in 2003, we suspected antioxidants might help the kidneys. Today, we know they can do much more. They can protect, preserve, and even improve kidney function. So, here's what we've discovered over the past 20 years, and what I want to focus on in today's video. We now know that there are 6 antioxidants, not just one, that every kidney patient needs. And here's the fascinating part: that single antioxidant can't compare to the full team of 6. Because when antioxidants work together, their effects are exponential, not just additive. You don't get 6 times the benefit, you get 100 times, according to science. So before you jump ahead just to hear which compound helped SR escape dialysis, ask yourself, are you getting enough of the antioxidants your kidneys need, or are you missing the one thing that could slow or even reverse your kidney function decline? Stay with me, because today's list could change everything. Let's start from the bottom and work our way up to number 1, the antioxidant that rejuvenated SR. Number 6, the antioxidant that has silently been fighting oxidative damage in your body all along is tocopherol, the natural forms of vitamin E. Now, don't let the fancy name fool you. Tocopherols are powerful antioxidants that play a key role in protecting your kidneys from oxidative stress, one of the main drivers of chronic kidney disease, CKD, progression. How powerful are they? In a study involving 59 patients with stage 3 diabetic kidney disease, tocopherol was able to reverse the progression of their condition. Imagine your doctor's confusion: wait, your kidneys got better? That's not in my textbook. So why is something so effective only number 6 on our list? First, because there are even more powerful antioxidants we'll get to. Second, because with great power comes great responsibility. Tocopherols are fat-soluble, meaning they can build up in the body, especially in CKD patients. And when that happens, it can become a problem. That's why you should only take tocopherol supplements in low doses and only if your doctor approves. Take a look at the dosage chart on screen. That's the maximum supplemental dose, not the starting dose, just the safety cap if you tolerate it well. But here's something most people, and most supplement labels, won't tell you: there's more than one kind of tocopherol. In fact, nature gives us a family of tocopherols: D-alpha, D-gamma, D-delta. But most supplements only give you DL-alpha tocopherol, a synthetic version that lacks the full antioxidant power of the complete vitamin E complex. And remember what I said about combining antioxidants for the best benefits? Because when antioxidants work together, their effects are exponential, not just additive. You don't get 6 times the benefit, you get 100 times, according to science. When it comes to antioxidants, it's not about taking high doses of one thing, it's about variety. Think about it. In nature, you don't get 400 IU of vitamin E from a single food. What you get are small doses of many different antioxidants working together. So where can you actually find tocopherol in real foods? Start with one of the most underrated kidney-friendly snacks: sunflower seeds. Just 1 ounce gives you up to 66% of your daily vitamin E needs. Other great sources include almonds, spinach, avocados, red bell peppers, and pumpkin. Add a handful here, a few slices there, and you've got a fantastic way to nourish your kidneys naturally. Alright, that's tocopherol done. Now let's move on to number 5, an antioxidant that doesn't just work solo, it actually boosts the power of everything else. This is the rocket booster to your antioxidant supplement routine, and you don't want to skip it because it makes every other antioxidant stronger. I'm talking about the most famous antioxidant of them all, vitamin C. By now, we all know that vitamin C helps with things like blood pressure, immune health, and wound healing. It also plays a big role in iron absorption and is one of the best natural detoxifiers out there. But what really earns vitamin C its spot on this list is something that's less talked about: its ability to significantly enhance the absorption of other antioxidants. When vitamin C is present, your body absorbs more quercetin, more catechins, more anthocyanins, more beta-carotene, more lycopene, and even more vitamin E. So now that advice to mix your antioxidants really starts to make sense, doesn't it? Here's an example: when you squeeze a bit of fresh lemon juice into your green tea, you're not just adding flavor, you're turning that cup into a therapeutic powerhouse. Why? Because that small dose of vitamin C boosts the absorption of catechins, the active compounds in green tea, by up to 500%. That's right, 5 times the potency just by adding lemon. And that's why I keep saying that you don't just want one antioxidant, you want a bunch of them, and you want them working together. So, think of vitamin C as a personal trainer for your antioxidants, always yelling at them to work harder. Come on, catechins, is that all you've got for absorption? Now, can you get vitamin C from foods without increasing your potassium levels? Some of the best low-potassium sources of vitamin C include red bell peppers, cabbage, cauliflower, broccoli, and of course, lemons. You can also enjoy strawberries in moderation, they're another excellent source. What about supplements? This is where you need to be careful. Never take high doses of vitamin C, especially if you have kidney issues. High doses can lead to kidney stones. It's like setting off fireworks in your bladder, incredibly painful and definitely not recommended. Keep your dose reasonable, that's the sweet spot. It's enough to boost all your other antioxidants without overloading your kidneys. Alright, vitamin C, the ultimate enhancer, checked off the list. Now it's time for number 4, a nutrient that's not just an antioxidant, but also an energy regulator, a blood sugar protector, and a silent detox hero for your kidneys. Let's talk about zinc. Now, zinc isn't just important, it's essential, meaning your body can't function without it and can't make it on its own. You have to get it through diet or supplements. Zinc plays a central role in immune function, tissue repair, blood sugar balance, and even stabilizing cell membranes. It's like a microscopic bodyguard for your kidneys, always on the front lines protecting them from damage. But here's the really interesting part. Zinc has been directly linked to slowing the progression of chronic kidney disease, and that's not something you hear every day. Slowing CKD progression, that's the holy grail right there. So, how do you get more zinc? There are some great plant-based options. Pumpkin seeds are the heavyweight champion here. They contain more zinc per ounce than almost anything else in the plant world. Cashews also pack a good dose and are incredibly versatile in a kidney-friendly diet. But here's a fun fact, many people actually get a decent amount of zinc from something as simple as oatmeal. So, your morning bowl of oats isn't just filling you up, it's helping your kidneys too. However, zinc is generally more concentrated in animal products, so if you're on a plant-based or low-protein diet, you may want to consider a supplement. Just one thing, make sure your zinc supplement includes copper. Why? Because high doses of zinc can block copper absorption, and copper deficiency doesn't just mess with your energy and blood health, it can cause anemia. So remember, supplementing zinc without copper is like trying to drive a car without fuel. You won't get far, and eventually, something's going to break. Coming up next, number 3 is a nutrient most people are severely lacking, and it plays a crucial role in keeping your kidneys healthy. This next nutrient isn't just powerful, it's actually been used in medical literature to improve kidney function. I'm talking about selenium. Now, when something as safe and essential as selenium is shown to help CKD patients restore kidney function, we definitely need to pay attention. Selenium is both an essential trace mineral and a powerful antioxidant, which means your body needs it, can't produce it on its own, and will certainly suffer if it's deficient. And the benefits? Let's just say it punches way above its weight. According to a large meta-analysis, selenium supplementation has been linked to a 24% reduction in cardiovascular disease risk. And if you're living with CKD, you already know that heart disease is one of the biggest dangers out there. And there's more. What many people don't know is that selenium also protects your thyroid, and this is a big deal. In fact, your thyroid contains more selenium than any other organ in your body. And because CKD puts extra stress on your thyroid, keeping your selenium levels up is one of the best preventive moves you can make. So, where can you get more selenium? Plant sources include sunflower seeds, brown rice, and mushrooms, but the gold standard is Brazil nuts. Just one nut a day can give you all the selenium you need, and then some. But remember, selenium is powerful, and you don't want too much, so stick to the dosage shown on my screen and never take high-dose selenium. The goal is simple, avoid deficiency, not overdose. Now, why am I making such a big deal about selenium deficiency? Because it's surprisingly common, and even mild selenium deficiency has been linked to kidney damage. Even better, correcting that deficiency has been shown to support recovery and improve kidney function. Speaking of improving your kidney function, if you're ready to stop guessing, stop Googling, and start following a real kidney plan, one that's actually based on your lab results, your lifestyle, and your goals, because a general plan might help, but a personalized plan, that's how you get real results. Our number 3, selenium, is already a powerhouse, but number 2 makes selenium look like a cup of lukewarm tap water. This next compound is one of the most powerful antioxidants on Earth. It not only protects the kidneys, it also detoxifies the liver, reduces inflammation, lowers proteinuria, and is even used to protect kidney patients from contrast agent damage during imaging tests. I'm talking about NAC, or N-acetylcysteine. NAC earns the number 2 spot because it's directly linked to lower serum creatinine levels and slower decline in kidney function. That's not magic, that's medical science. NAC detoxifies the liver and kidneys, something that clears out your system better than your ex cleared out your bank account. And while NAC might not yet be used to get people off dialysis like our number 1, it might just help you avoid dialysis in the first place. And here's another reason to love it: the longer you take NAC, the more your inflammation markers go down. It helps reduce homocysteine, inflammatory cytokines, and oxidative stress, 3 of the biggest culprits behind CKD progression. But perhaps NAC's greatest strength is its reliability. As you can see from my chart, NAC is safe even at high doses. Unlike some supplements that need to be stacked, cycled, combined, or taken with a wish and a prayer, NAC just works. It's well tolerated, safe even at higher doses, and extensively studied in kidney patients. Overall, this is one of those rare supplements where more can sometimes mean better, depending on your situation. Alright, now it's time for the heavyweight champion of kidney-saving antioxidants, the superstar supplement used in a landmark 2003 clinical trial to help SR and 8 other patients actually get off dialysis. That's right, off dialysis. Number 1 is CoQ10, also known as coenzyme Q10. This powerful antioxidant acts like a bodyguard for your kidneys, protecting them from oxidative stress and cellular destruction. But that's not all. CoQ10 is also essential for energy production in your cells, especially in high-energy demand organs like the heart, liver, and yes, your kidneys. Now here's the thing: most kidney patients are deficient in CoQ10 and don't even know it. This deficiency doesn't just cause fatigue, muscle pain, and brain fog, it also silently damages your kidneys, speeding up the decline you're trying to stop. That's why in the 2003 clinical trial, researchers gave dialysis patients high doses of CoQ10, and the results were stunning. In just 12 weeks, 9 patients improved so much they were told to stop dialysis altogether. I know it sounds unbelievable, but it really happened, and it worked. Let that sink in: one supplement, not surgery, not a new drug, a natural antioxidant helped them recover enough kidney function to walk away from the very machine that was supposed to keep them alive. Now, to be clear, I'm not saying CoQ10 is a substitute for dialysis or medical care, but I am saying that every kidney patient should seriously consider this supplement, especially those over 50 and those taking statins. And here's a pro tip: CoQ10 works even better when taken with selenium. These two form a power duo, enhancing each other's absorption and antioxidant strength. So take these 2 antioxidants at doses no higher than what you see here. Thanks for watching. God bless you.